Erin McCann with Healthcare IT News, and I have with me Michael Elley, the Vice President and CIO of Cox Medical Center in Branson, Missouri. So thank you so much for being with us here today. I appreciate it. Now, could you tell us a little bit about what's going on at Cox Medical Center? I know that you have some exciting
There's
things.
a lot of activities going on. One of the things we're really focused on is reducing the amount of avoidable readmissions that are coming into our organization. With the take back from CMS, that's been a big focus of ours. We've recently implemented a tool from T-System called Care Continuity. That's a tool that allows our organization to really route patients to primary care physicians in our service area. Currently, a lot of our population utilizes our ER as a primary care base, and really we want them to establish a relationship with our primary care presence in the service area. And so we have a tool now that whenever they come into the ER, and even if they're admitted, that we can now route all of that data from the ER visit or from the inpatient visit to our primary care physician population. And it also puts them into buckets. So if they have a higher risk of a certain type of diagnosis, that we have a group that's really managing that and monitoring that and making sure that they're working with the right physician to manage their care. It also adds business value to us as well, because more of our clinics are getting busier with these relationships that's being established with the patients, and they're not coming into the ER, where it's also more expensive for us to treat them, for patients to receive care in the ER. And it's much more affordable for both the patient and for us to be seen in a primary care setting.
So let's talk numbers. I mean, have you seen significant savings or significant reductions in readmissions? What are some of those?
Sure. Well, this is a new solution we just put in at the end of November and expanded a little bit out in December. But we have it across 20 of our clinics right now that are utilizing it, and we've seen overall readmissions decrease from about 9% to about 7.7% already in that short time frame. Our readmissions on AMI, CHF, and pneumonia are a little bit higher than that, and we expect to see a decrease of about 2 to 3% in those areas as well.
Okay. Now, how long did it take to get staff on board? Were they, obviously there's a training period to that.
Sure. Well, the deployment was very simple. It was done over a couple of days. Not a whole lot. The bigger work effort has been around all the workflow and how we're going to manage this population. The clinicians really don't have a lot to do, so it's good that we're keeping that off the physician's plate. It's really the office staff and our accountable care group that's really managing that. And it's something that's we have to do, and it's beneficial for our community to manage the population, manage their health. So it hasn't been a tremendous burden on them at all.
Now, Michael, CIOs are very burdened right now with a lot of additional projects, ICD-10, meaningful use, HIPAA compliance now with a final rule. What's top of mind for you right now?
Well, there's a couple things. We were just acquired by another health system, Cox Health, and so right now we're really working on all that integration activity of integrating another hospital into ours, and one of those are ICD-10, but also meaningful use. The organization as a whole has already met stage 1, but we're planning on all of the changes that need to occur with stage 2 and making sure that we're going to be on a similar platform, one vended solution across the entire organization.
Okay. Well, perfect. Thank you so much, Michael, for speaking with me. I appreciate it.
Thank you very much.